The horrific fire at the Mahdia Secondary School female dormitory in Region 8 claimed the lives of 19 persons, a 5-year-old boy and 18 girls, and injured many more. In the wee hours of Monday, doctors from the Georgetown Public Hospital Corporation were flown into Mahdia to provide treatment to those affected. There, the area was triaged and medical personnel from Georgetown and Mahdia got down to assessing the needs of the affected children. 9 of those children were airlifted to Georgetown at various times throughout Monday because they required critical care that could be provided at the Georgetown Public Hospital. Dr. Shilindra Rajkumar, a surgeon at the Georgetown Hospital, was one of the 2 doctors who went to Mahdia to provide support. He returned Monday afternoon with the last set of patients who needed critical care and updated reporters on the condition of those 3 patients.
So the 3 that we brought out, one seems to have had a predisposing condition. She has what seems to have a bronchopneumonia prior, because she did complain of cough, cold, and some fever prior to the fire. It seems as though the smoke inhalation might have aggravated that. We were watching her over the last few hours and we were hoping that she would have resolved, but coming on to the end of the day, she was not going anywhere, so we thought it best to have her brought out for further care. There is another one who has some amount of facial burns and she has some wheezing. We were trying to manage that in the field as well, but just before we were leaving, there wasn't much resolution, so we thought it best to bring her out. And who was the 3rd patient with?
The 3rd patient is another patient we suspect might have had an elemental inhalation injury. She doesn't have a lot of visible burns, but she also was referring, she was having difficulty breathing, pain to her throat, and she had carbonaceous sputum singeing to the nostril, which would have suggested she might have been in the fire for a while.
In addition to these 3 patients, 6 others came earlier in the day and were receiving critical care. One of the 9 patients brought to Georgetown was a 12-year-old girl who needed a limb-saving surgery because of the extent of her injuries. The surgery went successfully, but the girl remains under close observation as a burns patient. 3 other girls are receiving treatment in the hospital's intensive care unit, while another 2 are in the pediatric high dependency unit. Of those hospitalized, 3 are age 14, 1 is 12, and another is 13. The age of the last child is unknown. Meanwhile, a mental health team comprising stakeholders from various government ministries and agencies has been mobilized to provide support to students, parents, and other persons affected by the tragic fire. This is according to Minister of Human Services and Social Security Dr. Vindhya Persaud, who on Monday engaged reporters.
We are also creating a team to deal with the psychological aspects of all of this, so it will be a combined team going in from the mental health unit of the Ministry of Health, the Georgetown Public Hospital Corporation Psychiatry Psychology Unit, and the Ministry of Human Services Child Care and Protection Agency officer and the welfare officers, as we are now endeavoring to not only deal with those persons who are survivors and experiencing the trauma of the ordeal, but also their parents and families who also have to deal with that trauma and ordeal.
All of the patients, both at the Georgetown Hospital and in Mahdia, are being continuously monitored. Reporting for the newsroom, Shilindra Rajkumar.